I started my medical career in 2010. I became a registered nurse. I worked in neuro rehab, stroke care, and things like that. And then I ended up working in the neuro ICU. So I've kind of always loved neurology. So when I became a nurse practitioner, I then became interested in working in neurology in nurse practitioner capacity. And I've been in neuro ever since for about 10 years. I believe empathy and compassion is something that comes naturally to me, as it does to a lot of nurses. I have natural caretaking qualities and characteristics to myself, but it's really a matter of being able to put yourself in someone else's shoes and being able to understand what they, or at least try to understand what they go through on a daily basis. A lot of people who come to neurology, especially for headache and migraine care in particular, have maybe not been listened to very much throughout their experience in healthcare so far. And I really want to be a person that they can feel like I'm on their team, I'm there for them, and I'm there to support them, work together with them to find the best treatment instead of just sort of telling them what they should be doing. I'm here to help guide them through to hopefully allow them to find a better quality of life. I have been practicing general neurology for many years. For about 4 years, I've been more in headache medicine, but within that, I really like chronic migraine because I can empathize. I'm a chronic migraine sufferer. I have many family members with that. And it's one of those difficult things to live with because there's nothing outward that people can see. And yet you have something that can be extremely debilitating. Working with those with chronic migraine is sort of a passion of mine. But I'm also generally interested in lots of other areas of neurology. Have a lot of experience working with patients with memory concerns, and I really enjoy working with that population as well. Patients really, they want someone who is going to clearly listen to them, not just assume that they know what they need or what they're feeling, but to truly take the time and understand and treat them as an individual and try to work together with them to come up with a plan to help improve their situation, regardless of what that means. And so if that's something that I can do through my expertise, great. If that's referring them to someone else, though, I think would be really helpful for them, then that's an important aspect of it as well. So I really think my approach is holistic in a lot of ways because not everything works for every person. So really understanding where someone is, where in their life they are, what are their preferences for the types of treatment options that they would like, would not like, and other things that they may need to help support them on their health journey. I unfortunately have been on the receiving end of care that wasn't great. I've seen other patients experience care that wasn't maybe as individualized as they needed, or they felt like they weren't being heard. And unfortunately, that's just the reality sometimes of the healthcare world that we live in. And a lot of people feel rushed or they feel like they're just treated like every other patient, but really we really do need to have an individualized approach to treating every person. So that's really what I think is the most important thing to focus on. I actually got into neurology before I developed chronic migraine. I started getting migraines when I was working as a nurse. I didn't really quite realize that's what that was because mine didn't present exactly like a classic migraine. That's also something that I have really helped a lot of people with over the years is allowing them to realize that they do have migraine, even if it doesn't present as this very classic what we think of as migraine, because migraine can be so many different things. So yes, I have chronic migraine and I've tried many different things. I have many different treatments that I've used to manage it, but also knowing your limits and also taking time for self-care, even though it's very difficult, especially when you have a family and other things going on and a job, but just trying to do whatever you can to find balance in your life and stress relief in your life, and also just educating yourself. Being educated about what you can expect and having a realistic expectation of how you can manage your disease or your problem is also important as well.